Okay, can somebody confirm you can hear me?
Yes.
Oh, I already had these up. That's why it came up that way. All right, great. Before we begin, are there any questions? Let me close that down. All right, I'm not hearing any questions, so we'll begin. Let me share my screen. All right, you should be seeing my screen. Today is February 22nd, and we're supposed to be covering Lab 8, Identification of Gram-Positive Organisms. Let me remind you that your infectious disease project, your paper is due at 11:59 p.m. this Saturday. Any questions about any of that? All right, if there's no questions, let me also state that I did some grading last night, and I got a lot done. I think for you guys, I had Lab 6 already graded previously, but I got it graded for the Monday, Wednesday people. I decided to give you guys priority because you're always usually the last people I graded. So this time you're the earlier. And Monday, Wednesday were the last people to get graded. I think I've also graded the last couple of lecture worksheets. So take a look at your grades. Um, I fell behind a little bit on the grading, and I have a feeling after the unknown project comes in, I'm going to be way behind because that normally takes me a long time to grade, usually about a week for one class, and I've got now 3 classes. Boy, I hope that doesn't mean it's going to take me 3 weeks to get it graded. But I thought that the last lab I graded, which I think was lab 6, I thought it would only take me about 4 hours to grade, and it was more like 12 hours to grade. And that's why I fell so far behind. All right, let's talk about the lab. I think I'm going to close that down. I don't think we'll need that. Lab 8, identification of gram-positive organisms. In today's lab, we're going to talk about some gram-positive cocci, specifically the Staphylococcus, Enterococcus, and Streptococcus families. But we're also going to talk about some gram-positive bacilli, family Listeria, family Clostridium, family Corynebacteria, and family Bacillus. So both gram-positive cocci and gram-positive bacilli. Any questions about any of that? There are some video clips in this lab. There's case studies in this lab, and you'll need to use a dichotomous key to solve the case studies. The last two gram-positive, the dichotomous key and the case studies, you can find links to them in Canvas, and I'll show you that when we get to them.
Dr. Volpe, sorry to interrupt, but I couldn't find this particular document in the Canvas portal. I don't know if the other students found it and maybe I'm just not seeing it, but I went to
Are you
week.
talking about lab module 8 or the case
Oh, wait a
studies or
minute.
what?
Yeah, actually, I think I actually just found it. Sorry. I don't know why I missed it before. Yeah, I got it.
Okay.
Sorry about that.
All right. Upon successful completion of this lab, students should be 1, able to understand the principles and how to interpret the results for the CAM test, the bioesculin test, the SF broth test, and the optogen sensitivity test. We're going to talk about all of those tests today. And you should learn how to use the dichotomous key to solve case studies involving gram-positive bacterial infections. When specimens are received in a microbiology lab for routine bacterial cultures, They're inoculated on culture media that will facilitate the growth of common pathogens, and they're placed in physical environments to support their growth. Microbiologists do use colony morphology, meaning how the colonies look on the plate, and the gram stain to provide important information about the bacterial isolates. However, to identify the species, you do need to do further testing. And in our case, we'll do biochemical testing. Surprisingly, in microbiology labs, the majority of the labs still do biochemical testing. There is another way you can identify the species, and that is to sequence the DNA of the species. And surprisingly, the microbiological labs don't actually do that. But they do further biochemical testing. In this lab, we're going to talk about the CAMP test, the bioasculin hydrolysis test, the SF broth test, and the optogen sensitivity test. The CAMP test is named after the three scientists who first discovered it and then wrote about it. And CAMP is an acronym for those microbiologist names: Christie, Atkins, and Munch-Peterson. So C for Christie, A for Atkins, and then MP for Munch-Peterson. They first described the amplified hemolytic effect that some beta hemolytic organisms have when they're physically grown near Staphylococcus aureus. What you do is you do a single streak of Staphylococcus aureus, which promotes beta hemolysis on blood agar. And you place that single streak down the middle of a blood agar plate. Perpendicular to that, you do a streak of a test or unknown organism to look for enhanced hemolysis around Staphylococcus aureus. So there it is there. Let me blow it up because it's kind of hard to see this magnification, but if I blow it real big, you can actually see it. Let's go a little bit bigger. The Streptococcus pyogenes is really hard to see. That's why I have it so large. That is the streak of Staphylococcus aureus, and around it, you can see a clear zone, and that's the beta hemolysis that Staphylococcus aureus forms. And there we have the streak of Streptococcus pyogenes, and it's a real thin streak, sort of a yellowish color. And I think it's the photograph that makes it yellowish. Streptococcus pyogenes is not yellow, it's actually off-white. And around it, we have a region of beta hemolysis, complete hemolysis, which is the clearer regions of that. And like I said, that clear region isn't very clear there. It's kind of orange. It's more clear on the next picture. And that's just the way this photograph turned out. So Streptococcus pyogenes has the same hemolysis near Staphylococcus aureus as it does away from Staphylococcus aureus. So this we say is negative for the CAMP test. Streptococcus pyogenes is negative for the CAMP test. For a slightly positive CAMP test, we have Listeria. And here, this picture is a little clear. There's the streak of Staphylococcus aureus. And this is a real clear picture of the clear zone of beta hemolysis around Staphylococcus aureus. Blow that up just a little bit. There, oops, that's too far. There is the streak of Listeria, and I don't know why it's looking orange in this region, a little bit yellow there, but that's the streak of the bacteria. And if you notice around it, you can see a slight zone of hemolysis. It's very small, the beta hemolysis around it. But right there, we have enhanced hemolysis near Staphylococcus aureus. And this is slightly CAMP positive, slightly positive CAMP. Any question about that? On the third picture, let me scroll over. Once again, we have Staphylococcus aureus right here. This is the beta hemolysis around Staphylococcus aureus. This is a streak of Streptococcus agalactiae right there. And around it, let me blow that up a little. Oops, that's a little too far. Sort of lost it there. Around it, we can see a region, pretty thin here, but it is a region of beta hemolysis around, I'm just going to say strep A because I have a hard time saying that last name. And right here, we have greatly enhanced hemolysis near the Staphylococcus aureus. And you'll notice that enhanced hemolysis takes the shape of an arrow. The same actually with the slight camp reaction. That's an arrow too. I don't know. This, of course, is not enhanced because it's not near enough the Staphylococcus aureus, but that's the stick of the arrow and that's the arrowhead. I don't know why you get an arrowhead where there's more region of the hemolysis, enhanced hemolysis out here than over here, but it is normal to see an arrowhead in the camp test when it's positive. Any question about any of that? Oops, that's way too small. Ah, oh, that's better. Not quite good enough, but let's move it a little bigger. There we go. All right, the next test we're going to talk about, the spile esculin hydrolysis test. This tube has esculin in it, which is a light brown color, and esculin, with the bacteria that can hydrolyze the esculin, will produce esculatin, which is a dark brown color. And normally when you see it in the tube, it's a black color. So here in this tube, which is Enterococcus, it's esculin hydrolysis positive, showing the black, and the esculin hydrolysis negative tube, which is a Streptococcus family of species, are negative. This test is mainly used to separate the Enterococcus family from the Streptococcus family, but it can be used for other purposes too, but that's a major test for this test, a major reason for this test. All right, any question about bile esculin hydrolysis test? All right, the SF broth test is named after Streptococcus faecalis, which is the old name for Enterococcus faecalis. Many years ago, and I don't know how long ago, but at least 20 years ago, maybe 30 years ago, they thought that Enterococcus faecalis was a member of the Streptococcus family, and they called it Streptococcus faecalis. When the DNA of this species was sequenced, they learned that it is not a member of Streptococcus. It's actually its own family, and we call it the Enterococcus family. And I know the Enterococcus faecalis was discovered many years ago, like 100 years ago or longer. I'm not sure about the other members of the family. But like I said, this test is named after the old name of the species, Streptococcus faecalis broth test. And we usually just call it the SF broth test. And that way you don't need to know that it's named after Streptococcus faecalis, which is not a streptococci anymore. It is a member of Enterococcus family. Any questions about that? All right, the SF broth test is used to differentiate Enterococcus faecalis from the members of the Streptococcus family. It used to be the other members of the Streptococcus family, but today it's a different family. When the organism grows in the media, The media of the SF broth test is a purple liquid, and it does contain glucose. If the glucose is not fermented, then the SF broth test will be negative. There will be no change in the pH, and the media will continue to be purple. If, on the other hand, the bacteria can ferment the sugar glucose, it'll produce acid, and then the media will change to a pale yellow color from the acid switching the pH indicator from a purple color to a pale yellow color. So this is SF broth positive, that's SF broth negative. The Streptococcus family are all SF broth negative. Enterococcus faecalis is SF broth positive. Any question about any of that? All right. The last test we're going to talk about is the optogen sensitivity test. Optogen sensitivity test is used to differentiate Streptococcus pneumoniae from other alpha hemolytic streptococci. So you need to know, first of all, that the species is a member of streptococci, the family, and then it has to form alpha hemolysis on a blood agar plate. Let me blow this up. Here we're seeing alpha hemolysis. Let me blow that up even further. And the whitish area is kind of a pinkish red area, but white is the bacteria growing. And I don't know why it's that type of a shape, because that's a weird shape. Most of the time colonies are rounder than that. And this is definitely, it's forming a unusual colony shape. It almost looks like two colonies growing together, but it's not. That's the way the colony grows. Anyways, around that colony, you see the dark ring? That is alpha hemolysis. And then you take the bacteria and streak it in this region of the plate, or you can streak all of the plate. And then you put on the optogen, the disc containing the optogen antibiotic, and then you incubate the plate. If the plate is negative for optogen sensitivity, meaning there's a optogen resistance, there's either no zone of inhibition, or the zone of inhibition is less than 14 millimeters, which no zone of inhibition is less than 14 millimeters, then we say it's optogen resistant, and this Streptococcus, member of the Streptococcus family that promotes alpha hemolysis, is not Streptococcus pneumonia. It's some other alpha hemolytic member of the Streptococci family. Any question about that? And there's more than one species of alpha hemolytic streptococci, and that's why we just say it's not not Streptococcus pneumoniae. It's some other alpha hemolytic streptococci. Any question about that? Now remember, among the streptococci, some of them promote beta hemolysis, some of them promote alpha hemolysis, and some of them promote gamma hemolysis. Streptococcus pneumoniae promotes alpha hemolysis, and it is sensitive to optogen. And to be sensitive, you have to have the zone of inhibition equal to or greater than 14 millimeters. And then we say it is sensitive to the antibiotic optogen. Any question about this? I shrink that down a little. Get the page on all of the page on the page. All right. So there's a lot of biochemical tests we did. Once microbiologists have the results from the biochemical tests, they then use dichotomous logic to figure out what the species is that's causing the infection. A dichotomous logic is a thought process where you first begin with all possible species, and then you separate that into two groups. For example, you could do the gram stain, which I've actually got shown down here, and separate all of the species into the gram positive cells and the gram negative. Okay, so you do the gram test. And if it's gram positive, you then scratch out the gram negative, and you do another test to separate out the gram positive bacteria. And in this case, we're going to do the shape of the cells, separating the cells into gram positive bacillus and gram positive cocci. The cells are not gram positive bacillus, so we can cross that out, and they're gram positive cocci. And then we do another test to separate out the gram positive cocci. We do the catalase test. There can be catalase positive cells and catalase negative cells. The catalase negative cells are members of the family Streptococcus and family Enterococcus. The catalase positive cells are members of Staphylococcus family. The catalase result will be positive, and so we can cross out the negative result. We then take a test to separate out the catalase positive cells, and the test that was chosen here was coagulase. If the bacteria is coagulase positive, we've narrowed it down to one species, Staphylococcus aureus. If it is coagulase negative, then it's some other species of Staphylococcus. All right, so it's not coagulase positive, so we cross that out and then do another test to separate out the coagulase negative, catalase positive, gram positive cocci. The test we choose is the novobiocin test, and if it's novobiocin negative, then the species is Staphylococcus saprophyticus, and if it's novobiocin positive, then it is Staphylococcus epidermidis, and it's really hard to read that. All right, any questions about that and how you use dichotomous logic and a dichotomous key? If you have any questions, we have a link on working through an example of dichotomous logic. Where the heck is that? Oh, it's step number 3. That's right. All right. All right, so let's go to the laboratory exercises because you're not going to be physically performing any of these activities. However, you will be held responsible for knowing how to perform and interpret these tests. You can view the following video clips. The first discusses both the SF broth test and the bile esculin test. The next video discusses the CAMP test. Let's go to the worksheet now. Remember to only turn in the worksheet, not the lab module. The reason being the worksheet is much smaller than the lab module. And if all my students were to turn in the lab module, my Canvas web page would fill up, and then you guys could no longer submit an assignment. And I can't change that. I would have to just request to the Canvas people to increase the size of my web page. So far, it's only filled up one time, and all the users have taught it, Clark. So hopefully it won't fill up. All right. So in the lab exercise in Lab 2, review how to interpret the following test by completing the chart. The first example has been filled in for you. For the gram stain, for both cocci and bacilli, a positive gram test result, meaning a gram positive result, will be the cells will look purple and a negative result in the gram stain, the cells will look pink. So fill in the table like this, both the positive and negative results. For some of these tests, they are discussed in this lab module. For the optogen sensitivity test, the SF broth test, the bioesculin test, the CAMP test, they are all discussed in this lab module. For some of the other tests, you'll have to go back in a previous lab. I think oxidase and coagulase were discussed in the lab 7. I could have that wrong, but like that. For getting the catalase test, the negative stain for capsules, and the Schaefer-Fulton stain for endospores, you'll need to go back further in an earlier lab. So you do need to look up some of this information either online or in an earlier lab. Any question about that? And if you get the information online, make sure you verify it. Make sure it's either a reputable source or you find two sources that say the same thing, because anybody can put up anything online. All right, any questions about question number 2, filling in the table? In number 3, this is for those of you who are weak on understanding dichotomous logic and want to go through further examples using dichotomous logic. If you're comfortable with dichotomous logic and using that procedure, you do not have to do anything for step 3. And as you notice, there's no question here. So there's nothing to answer or nothing to do. It's just there if you feel the need to go through another example of using dichotomous logic and using a dichotomous key as well. In 3, it does mention the species that we're going to talk about in the case studies. However, you don't need to do anything about these. Okay? And step 4, this is where you're doing the case studies and you put in the species name that's causing case study 1. You put that in right there. In case study 2, you put in the species causing case study 2 right there. And then species 3 right there. And you'll note that on species 2, I'm giving you some information that is not on the case studies and it's not in the lab module. And that is test 2. They mentioned test 2. It's the basotracin sensitivity test. And so that's important information to know. And then you do that all the way to case study 8, filling in the information of the case studies here. Let's go through the case studies. To get the case studies, you got to get the information. Let me see if I can get that. Go back to the home page. It seems like either Clark College or my internet link is not working well because that was pretty slow. All right, lab module 8. There's the lab module. There's the worksheet here. And it surprises me the students who make a mistake because you have to click this link to submit the document. So that should be a reminder when you're in worksheet lab 8 that you need to get the worksheet to submit the worksheet. I do not want the lab module. The first time you send the lab module, you get a warning. Anytime after that, you're getting a penalty. Okay? All right. So there's case study 1. So you click on the case studies. And I just want to click on the infectious disease, no, excuse me, the dichotomous key. And it'll show you this, where we're taking all species and then you're doing the gram stain, separating them into the gram positive and the gram negative. Actually, we don't do the gram negative because this lab's only on the gram positive. And then we separate the gram positive into the gram positive cocci and the gram-positive bacilli. This is not a gram-positive bacilli, so we don't continue it here, but with the gram-positive cocci, we can then do the catalase test, separating out the catalase-positive species or families from the catalase-negative families. I'm not going to talk about the catalase negative. I'll talk about the catalase positive, which are members of the Staphylococcus family. We can then do the coagulase test. If it's coagulase positive, it's Staphylococcus aureus. If it's coagulase negative, we're only looking at two other members of the Staphylococcus family, Staphylococcus epidermidis and Staphylococcus saprophyticus. And it is coagulase negative. And then we can run the Nova Bayesian test to separate out the Staphylococcus epidermidis from the Staphylococcus saprophyticus. Any question about that? Anyways, that's how you use this key. And for the gram-positive bacilli, use the second page of the key. And here you'll note that this key only goes down to the family, with the exception of Listeria monocytogenes. That's a species, but all these others are only families. And that's the way this key is designed, meaning we're not going to identify the gram-positive bacilli down any further than the family. Any question about any of that? All right, let's go through at least some of the case studies. Let me go back to here. That the case studies, there are 8 of them, and the lead instructor sent me 8 files for the case studies. And I thought about linking them all together in one file for you guys, and then you'd only have this file on the case studies as well as the file on the dichotomous key. But it then occurred to me that the instructor could change one or a few of the case studies and then tell me to update the web page, and then I would have to change the entire case studies instead of just submitting the, let's say, changes case study 2. All I would need to do is submit case study 2 that he would send me. So I decided to leave it this way, and actually I'm glad I did, because he did change either 2 or 3 of the case studies at one point. And so that allows me to easily change it. Anyways, you have to click on the 8 links. Let's go ahead, and I'm not going to click on it there. I'm going to click on it here. And that's because they display better. Outside of Canvas, I can show the entire page. Case study 1. A 13-year-old teenager goes to summer camp, and upon returning home, his mother notices a pustule beginning to develop in a spider bite. And the area is warm to the touch and is becoming extremely painful. Her son then starts running a fever. She takes him to a walk-in clinic, and the physician orders a gram stain of the exudate and a routine bacterial culture. Here is the gram stain. You have to blow that up to see it. Oh, come on. It's not blowing up on me. There we go. Get that very large. Scroll down. Up. What happened? So there's the bacteria there. These are not bacteria cells. These are the Boy's cells. Okay. So tell me what that bacteria is and what the gram stain is. You need to record it just to answer the species. And there's the growth on the blood agar. You can note the hemolytic pattern. Let me shrink this down now. They then take the cells from the blood agar and do the catalase test. And there's the result of the catalase test. Oops, too far. All right, what am I doing wrong? Shrink this down. Oh, here it is. I thought that was the catalase test. This is the coagulase test, and they're putting the bacteria in a rabbit plasma, and after 15 seconds, you can see the results of the coagulase test. Here is the bacteria grown on mannitol salt agar. I'll inform you that this is the normal appearance of mannitol salt agar, and this is what the plate changed to once you grew the bacteria on it. And if you need information about mannitol salt agar, you can go to the Unknown Project, and one of the tests is growing the unknown on the mannitol salt agar. You can read about what's going on in this test. I think we did discuss this in the lecture last week, or maybe earlier this week too. Not today, but earlier. All right, then answer the question, what bacteria was isolated, and write that in the lab worksheet for lab 8. Any questions about that? We can go on to case 2. A 27-year-old female comes into the OB-GYN physician, and the OB-GYN physician does a routine vaginal culture, even though the expectant mother is not exhibiting any signs or symptoms of an infection. The Thayer-Martin tube has no growth. Lactobacillus, along with normal vaginal microbes, are cultivated on BAP. However, there are several colonies of interest. Let me see if I can show that. No, I can't. And these colonies were streaked for isolation on blood agar. And here's the results of the bacteria of interest on blood agar, so the hemolytic pattern. And there you can blow that up to see the gram stain, as well as the shape of the cells. Right there. Now shrink that down. Some further tests they did the catalase test. There's the catalase result. They then did test 2, which is the optogen test. Is that right? No, the basis trace and sensitivity test. Sorry. Basis trace and sensitivity test. And there's the results there. They then did the CAMP test, and there's the results of this bacteria on the CAMP test. And what bacteria was isolated? Oops, wrong thing. Case study 3. We have a 32-year-old male construction worker who comes into the emergency room after he got a sliver of wood in his jeans, and it penetrated the skin. And that was actually a short time later, because this is sometime in the day, and it's 10 p.m. and it's really red and sore and becoming infected. He's immediately taken into surgery to remove the dying tissue, and the surgeon orders a gram stain and routine culture. You have to blow this up to see this well. So these small ones are the bacteria. These big cells are the man's own cells. And there's the bacteria growing on blood agar. You can note the hemolytic pattern. And then take a look at the rest of the tests. And then answer what bacteria was isolated. Any question about any of that? Case study 4. A 73-year-old man is admitted to the hospital with pneumonia. He spikes with a fever and becomes a lack of alertness. The physician orders 3 blood cultures. At least one of the blood cultures comes up positive, and there you can see, I don't know what this is because that doesn't look like a blood to me, but there's the bacteria in the blood. Blow it up, you can determine the shape and the gram stain, and then they take from the blood culture and subculture and on blood agar plate, you can see the hemolytic pattern there. They do further tests on the species and what bacteria was isolated. Let's go ahead and close that one down too. Case study 5. A 38-year-old female who has a history of methamphetamine addiction comes into the dentist for major dental work. About a month later, she starts to have a low-grade fever, increasing malaise, signs of mitral cardiac valve anomaly. Her condition worsens. She's admitted to the hospital. The physician orders some blood work, and as you can see, there's the blood, and there's bacteria in the blood. And you can tell the pattern of the blood as well as, not the blood, the pattern of the bacteria growing in the blood as well as the gram stain and shape. They then do a subculture on blood agar plate, and there's the hemolytic pattern. They run some other tests, and then what bacteria was isolated. Case study 6. A 4-year-old girl is rushed to the emergency room with severe abdominal pain. She's rushed into surgery to remove a ruptured appendix. As a complication, she develops peritonitis. Peritoneal fluid is sent for routine culture, and you can see the peritoneal fluid is very cloudy, and there's the gram stain of the peritoneal fluid. That's her own cells. That is the bacteria growing in the peritoneal fluid. They grow it on blood agar plates, and you can see the hemolytic pattern here. And then they grow it on McConkeys, and there's only one colony growing on McConkey. The rest of the McConkeys is blank. That does mean something. Like I said, if you need to, I think we discussed McConkeys in the unknown project. I'll have to look that one up. McConkey's auger. Let me take a look here. Yep, right there. Then do further testing. And what bacteria was isolated from the girl. Case study 7. A 57-year-old diabetic female is admitted for replacement hip surgery, and she has a catheter for 8 days. She starts to experience suprapubic discomfort. Her blood pressure is normal. She doesn't have a fever, chills, or flank pain, but her physician orders a urine culture to be collected. And here are the findings. The blood agar plate after the urine culture does show you the hemolytic pattern, and then the gram stain of the bacteria, as well as growth on McConkeys. And a few other tests are done. And what is the species that was isolated from the lady's urine? Meaning she has a urinary tract infection. All right, the last case study, case study 8. We have a 29-year-old immunocompromised female. She comes into the hospital with the flu-like symptoms, personality changes, uncoordinated muscle movements, and seizures. Her husband states that she had attended a wine and cheese tasting event of the week prior. The physician orders a lumbar puncture to rule out meningitis, and her lumbar fluid is cloudy. And there's the gram stain of the lumbar fluid showing bacteria in the lumbar fluid. The lumbar fluid is in the, what do you call that? The central nervous system, the spinal cord, I think. Or maybe it's in the brain, one of the two. There's the bacteria grown on blood agar plates. You can see the hemolytic pattern. They do other testing. And what species do they get from this? I'll tell you that in this one, you have some extra information. This information is not in the lab module, but when they grow the bacteria in a semi-fluid media, meaning you stab it in there, the bacteria do not simply grow in the stab or grow out of the stab. It forms an umbrella-like shape of the growth. And you can look that up online if you want to see what bacteria have that umbrella-like shape. All right, any question about that? All right, so what species was isolated? By the way, you can solve this. Case study 8, where do we have that? You can solve this without this information, but if you want, you can go look it up. Okay. All right, any questions about Lab 8? If not, I'm going to turn it over to you guys to do the lab. I will be here until 8:15 to answer any questions. But once the last student logs out, I'm going to log out. So you should make sure you ask your questions or log in to ask your questions before the last student logs out.